Hi, my name is Caitlin, and this is Jamie. I'm going to be performing my physical assessment on her today. I've gathered my equipment, cleaned my hands, provided privacy. She walks with a steady, upright gait. She has appropriate clothing on for the weather. She's cleaned, well-groomed. No obvious deformities noted. Her skin is pale but normal for ethnicity. Her nails are manicured. Cap refill is less than 3 seconds. Now stop it. Jamie makes appropriate eye contact and she's alert and oriented to person, place, time, and situation. Upon assessment of her scalp, her skull is normocephalic with no lesions or abnormalities or deformities noted. Upon palpation of her sinuses, there's no redness or tenderness. Her temporal artery is palpable, and I'm going to assess her temporomandibular joint. Can you open your mouth? Okay. And again. There are no clicks and there's smooth movement within the joint. Her face is symmetrical. Her pupils are approximately 9 millimeters in size. They're equal, round, and reactive to light. There's no redness or drainage noted. Conjunctiva are pink. And now I'm going to check her peripheral vision. Tell me when you see my fingers.
No.
Okay. I'm also going to check her corneal reflexes, which are adequate and appropriate. Next, I'm going to check the 6 cardinal directions. If you could follow my pen. Next, I'm going to perform the cover test. If you could just stare directly at me, okay? And she has an appropriate response. And to perform a Snellen eye examination, I would have Jamie stand back 20 feet from the Snellen eye chart and read the furthest line that she could that is clear. Next, I'm going to inspect her ears. There is no redness or debris or drainage noted to the external ear. I'm going to pull up and back. There's no redness or drainage noted. Tympanic membrane is clear. And I'm going to do the same to the other. No debris or redness or drainage noted. The external ear has no redness or drainage or lesions, and the tympanic membrane is white. Next, I'm going to perform the whisper test. If you could occlude your ear for me and tell me what I say.
Baseball.
Now the same with the other ear.
Cardinals.
Very good. Next, I'm going to assess Jamie's nose. Her septum is midline with no deviations noted. Her nostrils are patent with no drainage. Turbinates have no deviations or abrasions. And there is no redness or swelling noted. Next, I'm going to assess Jamie's mouth. You open your mouth for me, stick out your tongue. Okay, now say ah.
Ah.
Gag reflex is adequate. Her uvula is midline and has good mobility. Tonsils are at 1+ grade. Soft palate is pink and moist with no lesions or abrasions noted. No redness or swelling. Teeth are intact. Upon assessment of Jamie's neck, it is symmetrical. Trachea is midline with no obvious abrasions or deformities. No jugular vein distension. Now I'm palpating her lymph nodes. And there are no palpable lymph nodes noted upon assessment. Next, I'm going to assess her thyroid. Can you turn your head this way for me just a little? And swallow. Her thyroid is movable. Can you turn your head left and right? And she has active range of motion and has good strength and mobility of her neck muscles. Upon assessment of her chest, her shoulders are symmetrical. She has no tenderness or masses noted. Next, I'm going to check her tactile firmitis. Say 99. Next, I'm going to oscillate her breath sounds. Take a deep breath for me. In and out. Next, I'm going to check for symmetrical expansion and cement. It is symmetrical. Can you stand up for me and turn around? Next, I'm going to percuss the posterior lung sounds. Then I'm going to oscillate the posterior lung sounds. Lung sounds are clear to oscillation bilaterally. Next, I'm going to check bronchophony. Can you say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99.
Turn around for me. Then I'm going to oscillate her heart sounds. First, I'm going to oscillate the aortic, and then pulmonic, tricuspid, and mitral. And here I'll take her apical pulse. Rate and rhythm are regular, with no ectopic beats noted. Heart rate is around 80 beats per minute. Next, I'm going to oscillate the heart sounds with the bell. I'm going to do aortic, pulmonic, tricuspid, and mitral. And heart rate and rhythm are both regular. Radial pulses are equal and strong bilaterally. Rate is regular. Can you squeeze my fingers for me? Patient has adequate muscle tone. You spread your fingers out and then pull them forward. Okay, now with your wrists and then your arms. And then your shoulders. You're going to go up, back, and down. Patient has active range of motion in wrist, hands, arms, and shoulders and has good muscle tone. Due to modesty, my patient would rather not lift her shirt, but in real life, I would lift the shirt and completely assess the abdomen. The contour is round. It is soft with no distension noted. Symmetrical. The umbilicus is midline. There are no masses noted. No abnormal pulsations or peristalsis noted at this time. Next, I'm going to oscillate the bowel sounds. Bowel sounds are active in all quadrants. Next, I'm going to oscillate the vascular sounds. sensations. Next, I'm going to do light palpation over the abdomen. There's no tenderness noted. Next, I'm going to do deep. There's no tenderness noted. I'm going to palpate the liver border. And the scratch test is not normally used anymore, but what I would do is listen and scratch with my fingernail over the abdomen to listen for the liver borders. Next, I will palpate for the spleen, and it is not palpable. Okay, stop it. Next, I'm auscultating above the liver. There are no rubs noted, and also above the spleen. There are no rubs noted there either. Next, I'm going to move on to lower extremities. Her lower extremities are symmetrical. Her skin is pale but normal for ethnicity. Hair distribution is even and no varicose veins are noted. Her popliteal pulses are strong and equal bilaterally, as are the posterior tibial. And the dorsalis pedis. Next, I'm going to have you put one leg up at a time, like you're doing a high knees. Okay? Now turn toward me. Can you do it up and back? Okay. Okay, now do up and out. Good. Now you can sit for the rest of it. Next, I'm going to assess the movement of her knees. She has adequate range of motion. Good. Now the same with her feet. She has active range of motion there. Good. There's no swollen or deformities noted in joints. She doesn't complain of any tenderness. I'm going to have her do some deep knee bends. Like a squat. Yes. And take a few steps for me and then turn around and come back. She has a steady gait, adequate balance and coordination for her age. Next, I'm going to check her Romberg test. If you could, leave your eyes open and raise your arms, palms up. Now close your eyes. There's no deviation noted. Good. Okay, now I have you bend over. No kyphosis or abnormal rotations noted. She has good mobility. Okay. Now bend backwards for me as far as you can. Okay. Now to either side. Good. Now twist at the torso. There you go. She has active range of motion in her spine. My patient is very ticklish, but I'm going to check her Babinski reflexes. She had an adequate response. The same on that one. Okay, next I want you to slap your thigh, flip, and slap the back as fast as you can. Good. Okay, next I want you to touch my finger and then touch your nose. Good. Now I want you to take your heel, run it down your opposite shin of each leg. Good. Now I want you to close your eyes. I'm going to take your finger, I'm going to move it, and you tell me whether I move it up or down. Up. Good. Next I'm going to test your sensation. Go ahead and close your eyes again. You tell me where I'm touching.
Head. Arm. Leg.
Which leg?
Left. Right foot.
Next I'm going to assess her deep tendon reflexes. First I'll start with the brachioradialis. And then patellar. Uncross your legs for me. And they are present as well as Achilles. Let your foot dangle. There you go. And this concludes my health assessment.